It's time for Talk on the Tee. Here's Johnny Chauvin.
Talk on the Tee, Part 2, being brought to you by The Steakhouse, where the steaks are cut and made to order. Make your reservation today at The Steakhouse, located at Square 71 on the corner of Southwest Road Avenue and Moore Street, right here in Hammond. And our guest this morning, it's North Oaks Health Notes Day, of course, and Colette Reece, the North Oaks Stroke Program Coordinator, joins us to talk to us about National Stroke Awareness Month. Good morning, Colette.
Good morning.
Welcome to the show.
Thank you.
Strokes, very serious, very dangerous, and sometimes we just don't know where they're coming from.
Definitely, yeah.
That's when it happens.
Difficult.
And it's like when whoever is with you at the time, like they don't know what's happening either. And so there are certain things that we want to talk about to be aware of strokes, what is happening, and the steps to make in order to make things hopefully turn out to be a better ending for someone.
For sure.
So stroke primary stroke center certification, why is that important?
So that tells us, as a primary stroke center, which North Oaks is, it validates that all of our critical resources that that are needed to make sure that we're meeting unique and special needs of our stroke patients in our community, that we just certifies that we have that ability.
Gotcha. So, and of course, May is National Stroke Month.
It is.
Right? And we are at the very end of May, this May 30th day. And you're here to talk to us about this particular acronym known as Be Fast.
Yes.
Like Be Fast, as in be quick. How do you translate that in the acronym?
It does help. The Be Fast also helps with that. Of course, you're right. You want to be timely. You want to be quick. With strokes, they're they're scary, but they're not something that you want to mess around with on time. It does help, the acronym on there, to tell us what specifically symptom-wise that you want to look for with your family member or loved one that you want to take them to the hospital for. So one of the things on there is B for Be Fast is your balance. Does your family member have a loss of balance? Are they dizzy? Are they having any difficulty walking? The E would be your eyes, your vision. Are you having any blurriness, any double vision? Can you see out of both your eyes? F stands for face. Does one side of your face look uneven, or is it drooping? You can always ask your family member to smile if they have any unevenness in their smile. That would be something to come to the hospital for. A stands for arms. Is one of your arms feeling numb? You can ask someone to raise both their arms. If you see any drifts downwards, particularly on one side, that would be something that you want to get checked out. S is for speech. Is a person's speech hard to understand? Do they seem confused? Are they having trouble understanding you? And T, again, it stands for time. You want to be if you have any of these warning signs, you want to be going quickly to the hospital. So you can call 911 as the fastest way to get there, to have EMS come to pick you up.
Mm-hmm. Now, is this, when you said Be Fast, and you named all of those different things that could happen from your face to your arms, et cetera, is it just one of them, or are you looking for all of them?
Any of them.
Any of them. Mm-hmm. So if it's just one, it's time to take action too. Yes.
You don't want to play around with it. If it's something that, even if it checks out and it's nothing, then at least you've looked into it. Right. It's better to be safe than sorry.
Right. And then 911, because that's part of being fast, right?
They can start interventions that you can't do if you're in your private vehicle coming to the hospital, and start initiating treatment and let the hospital know that you're coming to see us.
Right. So that saves, I don't know how much time, because otherwise you would be there trying to check somebody in, and they're still going through those symptoms, or they may be some added symptoms that are going on, and we're still trying to get checked into the hospital. Where if you're 911, you're in the ambulance, they alert the people ahead what's going on, or what this patient has, what to be looking for, and then they're brought into the stroke launch pad.
The launch pad, and if we know that you're coming, our staff is there waiting for you.
And they start running tests immediately.
Absolutely, they're there running tests and getting blood work, checking out, taking you through all the process that we need to screen you for strokes.
And when we think of strokes, we think of the elderly. Mm-hmm. But is the face of the stroke changing?
It's definitely. That is your classic, what you think of is your senior adults, but that doesn't mean that's why we see all kind of ages that come in through the hospital. But definitely there's any age. It's not a respect of any age. So anybody can suffer from a stroke. I think the Center for Disease Control says that now 38% of our population is hospitalized with a stroke under 65 years of age.
So what can cause a stroke? Like diet or blood pressure or what?
Your highest is blood pressure.
Blood
It's
pressure?
your high risk. Not the only, but it is the highest risk factor. You also can look at your irregular heart rate, like atrial fibrillation is one of them. Obesity, diabetes are some major risk factors to look for with stroke.
Even like bad habits like smoking and stuff like that?
Yes,
Yeah?
definitely.
Yeah. All right. And what happens when a stroke occurs? Like what is actually happening in the body?
That's where you have basically a decrease or complete occlusion of blood flow to your brain. As you know, blood carries your oxygen to your brain, which you need, obviously, for your tissue to survive. So anytime you have that happen, it's definitely time to come to the hospital. I mean, you want to be able to provide treatment for that and reverse that occlusion or decreased blood flow.
So the blood, it brings the oxygen to the brain, and the brain is what, of course, controls everything, right?
Definitely, yes.
Yeah. All right. So, and as far as the cause of death in Louisiana, any statistics on that as far as how the stroke affects us here in Louisiana?
In Louisiana, it's the fourth leading cause of death in Louisiana. It's the third in the United States, but Louisiana is our fourth leading cause of death.
Wow. And gosh, I'm looking at some other statistics here. People suffer a new recurrent stroke each year, 795,000 people. You have recurring strokes?
And if you've had a stroke before, you're definitely at risk for having another one again.
Are you? Okay.
For sure.
And why is the early diagnosis of a stroke so important? I think we kind of mentioned some of those signs too. Huh?
Yeah, you want it. The earlier we get, we can diagnose somebody and treat somebody, the better chances they have of decreasing their risk of disability or even death in some cases.
Gotcha. And what are some other stroke-related services that North Oaks offers?
We have, as well as the treatment that we provide in hospital, which we're one of the few hospitals in the area that can do a technique called intracranial mechanical thrombectomies, where we can actually go in and remove a clot from a patient in certain circumstances. We also have, on the outpatient side of things, we have a rehab hospital that our stroke patients can go to after discharge. That is one of 10 hospitals in Louisiana that is certified for by CARF, which is Commission on Accreditation for Rehab Facilities. And we also have a stroke support group in Hammond that they meet the first Wednesday of every other month from 12 to 1 at North Oaks Hospital. It's a free service that they are able to provide support in education for our stroke patients and their caregivers. And we have our
new mobile bus?
Yes, it's very nice.
It is nice.
We have a new mobile care clinic that it's 38-foot blue and gold clinic. They're able to provide free stroke screenings for our patients or people in the community. They also do blood pressure checks. They do diabetes risk assessments, medication management, and education for things. So they're a great resource if you want to go out there and not have to go to the hospital, but come get checked in a clinic. So they're throughout the community. They have ways, if you want to see their schedule, we have an online spot they can get on northoaks.org/mobile care, or they can call 985-230-CARE-2273 if they want more information.
All right. Anything else before you head out, Colette?
I think that's it.
All right. Again, for more information, you can log on to www.northoaks.org/mobile care or 985-230-CARE-2273, and also northoaks.org/stroke care if you want to find out more about strokes and how to prevent them and how to recognize them as well. Be fast. Right, Colette?
Absolutely.
All right. Thanks for joining us this morning. We
Thank
appreciate
you.
it. Colette, our guest this morning, Colette Reece, the North Oaks Stroke Program Coordinator. This is May, National Stroke Month, the end of May. All right, 12 before the hour of 9 o'clock, Talk of the Tea.